pleasant evening. 75-year-old Santana Krishnan wants to make the most of the good weather by putting on his shoes and heading out for a walk. It is his favorite form of exercise. But not so long ago, walking was an activity he preferred to avoid.
I've been to doctor with no complaint except in that I was feeling tired, frequently getting fatigue, and I was not able to keep up my routine walk. I used to miss very often than ever. Then I thought there is something radically wrong. We have to just get checked up. I went to a nearby doctor. Then he said, from the symptoms you are giving, I don't find anything wrong with you. Take this vitamin tablets. He gave for about a month. I have no improvement. In the sense, temptation-wise, you feel like going for a morning walk, and then you will just skip it for evening. Evening you skip it for morning. Like that, it was getting postponed. Then finally, I thought that something should be done immediately, and we will go and get myself. Let me get myself admitted in the hospital. I just went and waited for about 2 hours, and then met her and I repeated my symptoms. She also said, I don't find anything in Santana Krishnan from the way you are describing it. Maybe that age is telling upon you. I said, the age tells upon you is fine, okay, but then the tendency to even to complete the work, target the work, is not taking place. I'm getting a tendency to postpone it. Then I said, if that's the case, let me go for a checkup. Though I am due for a checkup next year, but I will go for a hospital checkup.
Santana Krishnan has always been particular about getting periodic health checkups. It was in one of these regular checkups that an anomaly had detected, and he was referred to a gastroenterologist.
Santana Krishnan has had health checks with us since 1995, and he meticulously comes for a health check year on year. So in 1995, during his first presentation, we detected anemia, and then on we examined him. He had hemorrhoids, and following which he had a hemorrhoidectomy or a surgery for piles. Again in 1999, he was diagnosed with a triple vessel disease and underwent cardiac surgery. This was after a routine health check as well. And then in 2014, during a routine health checkup, we diagnosed him to have an enlarged prostate, but thankfully his PSA and other tests were normal, and he had a normal quality of life. In 2015, he presented with tiredness symptoms, and after a routine health check, we diagnosed him with a cancer of his intestine.
I went for endoscopy. In endoscopy, it was found out there's a small ulcer, but then after seeing that, the plates, or they will call the photos and whatnot, this small dot cannot contribute for this much of reduction in hemoglobin. Whether you go for colonoscopy. Then I told the doctor, colonoscopy means I have to get admitted. I won't be able to do as an outpatient. He said, okay. You are admitted. Third day the colonoscopy was done. Then they found out a small growth in the colon area, colon tract.
Once the diagnosis of colon cancer was confirmed, Santana Krishnan had to undergo a right hemicolectomy without any further delay. Colon resection is a surgical procedure in which a diseased part of the large intestine is removed. The colon is a long muscular tube located at the end of the intestinal tract. After the stomach and small intestine digest food, the remaining material passes through the colon where water and electrolytes are absorbed. The residual stool passes into the last 6 inches of the colon, known as the rectum, where it is stored and released. Colon resection is usually performed to treat colorectal cancers and other serious conditions. The surgeon will begin by making an incision into the abdomen over the part of the colon that needs to be removed. The surgeon will clap the colon in 2 places on each side of the section that needs to be removed. Then there will be a cut through the colon to remove the injured portion along with a margin of healthy colon and surrounding tissues. Finally, the loose ends will be joined together. After the procedure, the surgeon will put drains to collect fluid that may accumulate around the surgery site. Close the wounds with sutures and cover it with bandages. Santana Krishnan made a swift recovery after the surgery and managed to resume all his daily activities in a short span of time.
Skipping the walk, a tendency to skip the walk was, started sitting in the mind. Then, when I went for a medical checkup, it was identified it was a loss of hemoglobin, and they were identifying where from the blood was losing. It was from a colon area. Then they said they have to get it removed. They removed it, and it went on. About more than 4 months now, I'm all right. I have no issues on health side or side effects of this procedure they carried out. I regained my walking, and now I go for about nearly 35 minutes. Slowly I started at 10 minutes, 15 minutes, 20 minutes. Now I go for 30 minutes walk. It covers, in addition to that walk, what I do in the inside the house walking. I'm all right.
He's recovering very well now. He has pretty much a normal quality of life, and his do's would be to follow the advice of his specialist, to go for regular oncology follow-ups, and of course to report if he has any untoward symptoms like rectal bleeding, constant tiredness, anything that upsets him in any way as far as his intestines are concerned or his general symptoms. He must see his specialist and discuss it with him.
Santana Krishnan had put his best foot forward and walked through the entire journey with a positive frame of mind to become a cancer survivor today. His story is testimony to the fact that trusting one's instincts and consulting the doctor when something goes amiss with health is clearly the best thing to do.
Of course, Mr. Santana Krishnan used every chance he had in those 20 years, because whenever he attended, there was something that we could find and treat at the appropriate time. So it's very important for people to, when they present early, because the outcomes are better. They are financially better because their costs are not so much when diseases are diagnosed, and their treatment options are better as well. So anything that makes you feel other than normal is something that you must take to your doctor.
Hello everybody, I'm here to give you an update on Mr. Santana Krishnan and Mr. Palniappan. Mr. Santana Krishnan underwent chemotherapy and has coped well with it. As part of his plan of treatment, he continues to have regular checkups with his oncologist. Thanks to his care team, he's enjoying his retired life. Mr. Palniappan is doing fantastically well after his PTCA. He's very compliant with his medications and has great control of his blood pressure, sugar and cholesterol levels. Folks, prevention is better than cure. After having completed 12 million plus health checks that include personalized genetic testing, we truly believe that the first and best line of defense is having your yearly health checks. Folks, a person who has health has hope, and a person who has hope has everything. Truly, life is priceless. Goodbye for now.